placing this at 5.85 million gap, but still it's a very fragile advance, so we would need to really step up. If we do not, we could actually have a greater deficit by 2035. This is not cast in stone. The progress is not linear. Then we also have seen these figures before, that gaps in clinical competencies have been observed, and we have, first of all, 62% are correctly diagnosed, but when it comes to the treatment, we have only 40% correct management, and if it's a complex situation, like conditions, for example, combined conditions, then the accuracy is even more reduced to 27%. So let's now look at what's happening in the health professions education in Africa. The baseline assessment that's been conducted has revealed that yes, there is a rapid expansion of training capacity, but that educational transformation lags behind. When I was talking with my in-house professor on this chapter of the workforce, I got a bit sensitive because I thought it's something about people with gray hair teaching using methodologies that were outdated, and I was a bit sensitive about that. But the young professor explained to me that it's not about that. Yes, some of it is that we are trying to teach people the way we were taught 30 years ago. But there are other factors that, for example, we have people in the classroom as professors who are experts in their fields of work, but are not actually teachers. So the capacity, the ability to teach does not depend on the expertise in the subject area. It depends on a lot more knowing how to communicate, to transmit what you know. So the transformation is really about not just the methods and the tools that are now available that must be incorporated into how we teach, but also understanding that we cannot stay with the same curricula that we had 20, 30 years ago, when the epidemiology and the challenges we were dealing with were different from what we see right now. There's also something in the assessment systems that we still focus a lot on examinations, passing examinations, but we don't pay enough attention to actual competencies. Then in terms of the exposure during training, there is a lot of concentration. The specialization takes place sometimes in the level 6 hospitals, and the graduates that come from there are not necessarily prepared for the conditions in which they're going to work, which do not have the machines and all the access to the expertise, the expert accompaniment that they have in those level 6 institutions. So they will have a struggle when they go to a reality where the equipment they have been trained on do not exist, and they have to come up with totally new ways of dealing with the situations that confront them. And finally, that educational institutions focus on complying with the regulatory bodies, the accreditation. So they will come and look at the facility. Do you have, what number of equipment do you have, what number of doctors, what not. So it's really just ticking off boxes on, yes, we have this, we qualify this, we can tick them off. When you say this institution is accredited, what does that actually mean? Is it the practice, or is it the window dressing when the regulators come around to make those assessments? So we zero in on the missing, the variable that is critical, competency. So the system performance should be fixed on competence. And competence is not about knowledge and skills. It's really about the ability to integrate knowledge, skills, judgment, professional identity, and be able to apply that in clinical conditions that come in reality. It's not, okay, these when the patient comes, these are symptoms, and you move on, and this is the treatment that you're going to give because they have malaria. There are going to be complexities that you have to be able to integrate into your thinking and revise your approach to the management of that case based on how you bring together information from different areas, the judgment and all that. So there are signals that we can use to identify gaps in competency. When we see that the graduates require prolonged supervision, and sometimes this is not available, unfortunately, and perhaps that's part of the reason why when graduates are sent to rural areas, they can't survive because they don't have the close supervision that they have been trained to expect. Then there is weak preparedness for team-based practice. So the training of a medical doctor focuses on what a medical doctor does, but does not necessarily integrate how the medical doctor should work together with the nurse aide, for example. So we need to be able to also to train our graduates in such a way that they are prepared for team practice and therefore can make full use of the skills that do not necessarily come with their own particular expertise and training. Then we've seen, as implied, limited application of critical thinking in operations. How do you bring together different, how do you operate when you do not have the machines that you had? How do you manage a patient when you do not have the sophisticated machines that you were used to having? Plus, when we look at primary health and community orientation in the training is much of the time quite limited. So when they are, again, posted to the outposts, it becomes extremely difficult for them to manage in those settings. So going back again to our health workforce strategic initiative, we are looking, yesterday we were looking at plan. We were looking at that, the Africa Health Workforce Investment Charter, which is based on a planning process. You look at the evidence, you plan, and you determine how many workers you need. The second part, the train, is about transforming professions in Africa, and this is going to be our main focus as we move into today, where we are eventually we'll be looking at retain also. We'll look at that tomorrow, but today we're going to be really zeroing in on this aspect of transformation of our health professions. So it has 5 components, and we have already started with the first component, which is the development of the competency-based curricula. Some of you who are in this room have been partners with us for the long duration that it took to get to that, and it's wonderful to see you all holding together as we move forward in this process. And we are also now, that's quite advanced, and we'll see some of the curricula, the competency-based curricula that we have developed. Please keep your phones and scanners handy, because something is going to flash up that you'd expected, not just yet, but I'll let you know. But keep those phones closed so that you can download the documents in a click. So the second component, let's look at what we did in the first component. Wow, my goodness. In November 2025, last year, we launched the WHO Africa Prototype Competency-Based Curricula for 10 selected professions. And this was work that had taken place over a period of 18 months of very, very broad consultation. We had our professionals from across the region working with us, reviewing the curricula and helping us to really respond to the changing needs and the robust baseline that we should set, so that when those curricula are adopted and adapted, they really respond to the needs. They're flexible enough to respond to the needs of the different countries, so that they are not one size fits all, but something that can actually be transformed for each country according to their needs. So that consultative process involved 300 stakeholders, and we came up with those documents that are available online, as we're going to show you in the next one. So I told you we have 10. You have, I can't read them from here, and I don't think you can read them from where you're sitting, but there's 10 of them, and we will see a little bit of the celebration that we had, so that those who are not there can participate also in hindsight, remotely. So that's it. Now, I'll pause so that you can scan and download those documents in a pic. So as you can see, we are also getting on. We are catching up with the technologies. We may have been trained before these things came up, but we've been helped to come up to speed. So I think everybody, I'm seeing phones lowering. So I hope that's good, that we can move forward and begin to look at component 2, the health professions, education in Africa. We want to move from fragmentation to harmonization. And we looked at, what was the problem? The problem was that the systems are fragmented. When you look at quality assurance systems, the pedagogy standards, the regulatory standards, the pedagogical approaches, all those, there's limited comparability that allows us across the countries to bring together systems that would be able to complement one another. And then we have the challenge of mobility. Dr. Janabi was just speaking about being allowed to practice in Nigeria, having graduated from Tanzania. And yesterday, when we were talking about mobility, we think about mobility from here to the UK, to France, to Canada, but mobility within the region is something that should be easier to manage. I think it's happening. It used to happen, in fact, when East Africa had training colleges that were training for all of the East African region. I don't know if it still holds together as well as it did at that time, but I think we need to go back and look at those possibilities and really recreate those linkages. And then that, of course, requires that the standards are harmonized, because we need to be able to actually move towards recognition. So in summary, the Africa Health Professions Education Quality Standards, it's a process that is involving regulators from various countries in the African region. We have already had a meeting, and I'm very glad to recognize the presence here of Professor Chris Miles from Northwest University. They hosted us in Potchefstroom. What a name. We came up with that. We even came up with a declaration of Potchefstroom. To make sure that it's extremely, it catches your attention at once. What was that declaration? Really, but it's to bring together, to build consensus, and we are heading towards that, of African health professionals. We had professors from across the region, from the West African region, Central and East Southern African, coming together to see how do we bring those together. Of course, they are also internal within countries. They also need for that the standardization, because there are inequities within countries, so we would also have to work within country. But our concern, of course, as a regional institution, is to see that we can build this regional consensus. So in the first phase in this component, we have done the evidence, we've brought together the evidence, we have done the drafting, we had the regional consensus, as I have mentioned, and what we have come up with is the Africa Health Professionals Quality Standards, which has 9 domains and 32 standards. So this is a work that we are moving ahead, and we are very keenly aware that we need to have the partnership of our institutions across the continent. We want to really align, and I'm very glad to have the African Union, we want to come together as a region and really make this something that is politically sanctioned at the highest level. We're going to bring it to the regional committee of the health ministers, but we would like, with the support of our institutions, to also take this to a continental level, because what is going to help that movement of professions across is, in fact, I think, within the framework of the free trade area. And that is something that is in the hands of our highest level of political governance on the continent. So we are looking forward to the next steps and to working very closely together so that we can support the policy framework that will make it possible for the mutual recognition of the qualifications to advance the mobility of health professions across Africa. This is very important because we can't be making bilateral agreements with Europe and North America and Australia and Japan when we could be doing a lot more to help the needs within our own region and continent. So they tell me that good storytellers know how to do flashbacks, and I'm going to take you back, therefore, to a very, very special moment that we had in November 2025 in Pretoria. I cannot tell you how grateful I am to this team, how proud I am of this team, how grateful I am to our elders, our ancestors, our experts. We look up to you. Thank you so much.
We are very proud of our long-standing collaboration.
That was the long process to get us to where we are today. From conceptualization to where it is now is about 1.5 years of work.
Ladies and gentlemen, the moment we've all been waiting for has arrived.
Competency-based curriculum for emergency nursing. Prototype competency-based curriculum for pediatric and child health nursing. Curriculum for pediatrics and child health medicine. Prototype competency-based curriculum for undergraduate medical education, for advanced midwifery. And now we have the prototype competency-based curriculum for critical nursing care. Prototype competency-based curriculum for obstetrics and gynecology. For our mothers. Frameworks for health professions graduates in Africa, Volume 1. There's more to come. Wow. The prototype competence-based curriculum for general surgery.
Ladies and gentlemen, we've celebrated. Thank you very much for coming through and for being part of this exciting event. We're looking forward to a great future. From the G20 to the launch of curriculum. Well done, Africa. Well done.
Thank you so much, Dr. Onyango, for setting the scene and even sharing that video. I feel like I was at that event, even though I wasn't there in person. Thank you so much. My name is Dr. Jacqueline Kitulu. I am the president of the World Medical Association, which brings 180 national medical associations together and representing over 10 million physicians in the world. And with the mission of achieving the highest standards of medical education, science, art, and most important, medical ethics, so as to be able to provide quality health care for all globally. I am delighted to moderate this session, and this session on transforming health professions education in Africa. So Professor Champion there has given me a very large panel that I have to have 2 sections of the panel. There are 2 more speakers for this initial part of the panel. So I will call on Honorable Marceline from Director of Human Resources Guinea. I think we had called earlier and she wasn't in the room. Please welcome. And the final other speaker for this session from Madagascar, Mr. Rob Corteson Alain. Please come up to the podium. So in this first session, which we have directed to countries, the question will be around, we already have seen the competency-based curriculum has been launched. We are looking at curriculum transformation. And the question that will be coming to you will be building on that recently launched Africa prototype competency-based curriculum. What would it take for your country to adopt and implement these curricula within national systems? You may perhaps also look at it, what are the initial steps that your country would prioritize to accelerate the adoption of the competency-based curriculum? So as we take off on that initial session, I will start with Honorable Joy Nyokuru, Director of Human Resources, Burundi. The question goes to you. Yesterday we had a very interesting session and there was a lot of listening and telling from your own countries. So we shall hear from Burundi. Honorable Joy Nyokuru, you have 4 minutes. Thank you.
Merci, Madame la modératrice de ma...
responses. There is also adequacy of supervision infrastructure and equipment. There is also another challenge in terms of massive by way of achievement. Government has able to set up a stabilization fund for doctors in order to stop massive immigration abroad. The country also, in collaboration with the World Bank, has set up projects on human capital, providing scholarships for the training of doctors and all the health staff generally to be able to undertake capacity building in human resource. We have the WHO in Abel, which also support capacity building in human resource in health. Without much ado, I will also respond to the question that was addressed to us concerning what country would want to do to implement this program at a larger scale in our country. For Burundi, I think, first of all, there should be a political dimension. That is, our country should, first of all, align and position itself in terms of education based on skills. Skills-based education. That means the higher authorities should, first of all, take ownership of this program. They should own this program, and if they do so, they can thereby facilitate the implementation of this program and scale it up in our country. To achieve this, there's also the need to have intersectoral governance, that is, Ministry of Education and Scientific Research. Because before, the paramedical institutions were under the tutelage of the Ministry of Education, and then later they were placed under National Ministry of Education, as opposed to the Ministry of Health, under which they were placed earlier. Concerning the staff, with the collaboration among partners, we intend to raise the numbers to 60,000 with the support of partners. So I've talked about the political dimension. There is also the technical dimension. So to implement this program, we need a skills framework for doctors. You have skills like laboratory technicians, midwives, nurses. So we should first of all align with the health priorities and also with universal health coverage principles. To my mind, there should also be a skills-based education model for Burundi. We should also know how we will measure the skills, Also, we have to train the lecturers, the teachers, because we have inadequate numbers of qualified teachers. This can be done through South-South partnerships, whereby the lecturers from the universities are people who have studied radiography. You study radiography, but you have never seen a machine, so they need to go to the field. They have never seen a radiography machine. To practice with. So in a few words, so as not to take so much time, I would like to end here and say thank you.
The Director for Human Resources Burundi, a lot of things coming through, government ownership, intersectoral collaboration with the Ministry of Education, partner support, and of course ensuring there's the infrastructure for, that competency to be actually established in the clinical setting. So I will move on then to our next speaker, Dr. Sergio Chikunde of Mozambique. And the question really is, in Mozambique, what would be the initial steps that your country would prioritize to accelerate the adoption of the competency-based education? You have 4 minutes. It's quite a large panel, so stick to your time. Thank you.
Bom dia, muito obrigado. Vou falar em português. Antes de mais,
thank you. I will speak in Portuguese. Thank you. On behalf of the Ministry of Health of Mozambique, I thank you for inviting me to this forum to talk about human resources in the health sector and also talk about the training of human resource. Mozambique has a significant base for making progress in this program. We have a national authority for technical education covering the health sector. We have a National Council for Evaluation and Accreditation. So it links up with the Ministry of Education, and of course recently we approved the first national law on the national health system. In this law it is clear that there's a need to consolidate the health staff based on an innovative curricular development program in collaboration with the Ministry of Education. In Mozambique, we have an important network of training institutions, both public and private, and this network is not well distributed across the country, but it needs to therefore transform the teaching staff so that competence-based training is adopted. So we need a massive training for the body of trainers and lecturers. We also need clinicians because we need to understand the division of labor among the teaching staff. We also need to get in touch with the leadership of the national education for purposes of coordination, because we need to adopt a competence-based education system. Indeed, education attracts a lot of attention because it's a very important field where civil engineering, construction is focused on, while the health sector is neglected. So we need to get in touch with the Ministry of Education and develop prototypes of program and adopt competence or skill-based training programs. We also need to transform the hospitals into training institutions, centers of excellence, so they can handle issues relating to the training of clinicians. We cannot also set aside the issue of strengthening digitalization, consolidating digitalization. It is a necessity because urban centers benefit more from such facilities, and there is an existing network that takes advantage of consolidating digitalization. I think it is a program that involves students in rural areas. To conclude, I think, well, this alignment with the Ministry of Education is ongoing, and there is the adoption of this law on the national health system, and there is also the will on the part of clinicians to adopt new forms of training of students. Thank you.
Input and also just again new things coming in, digitalization, the same again aligning on with the Ministry of Education, increasing access even to those students who are in the rural areas. So thank you for that input. As we move on to the next country, we look at Madagascar, and Mr. Lane is the Director for Human Resources for Health for Madagascar. And it's still the same question. We're trying to understand what's happening at country level. How are we, what is Madagascar doing to prioritize or accelerate the adoption of the competency-based curriculum?
Thank you, Madam MC, for giving me the floor. Dear participants, allow me to share what Madagascar has done with the support of the WHO and then the World Bank. This we have different kinds of training in our country. With regards to the initial training, we build capacity for teachers in the teaching hospitals. And we did this at the level of University of Quebec. At the University of Quebec, we developed a curriculum and also a program for capacity building. Also, care centers have been renovated for public institutions, and we've done this for nurses and then for midwives. There's been initiatives for reviewing the midwifery courses at the national level. And these activities are conducted with support from the World Bank and then WHO. With regards to the CPD, our country has established a regional training office so that continuous training will be decentralized. Also, we continue CPD through learning platforms, and this has helped to reduce the rate of absenteeism at workplaces. In order to make this CPD texts have been drafted and then brought into force, and others are still being drafted. Our technical and financial partners have contributed to this training. Thank you.
So much. Again, there's a lot of innovation going around in terms of even CPD and online and, using digital platforms, building the capacity even for the teams to implement the curricula on hand. We have another speaker from Guinea, that's the Honorable Marceline, and she's the Director of Human Resources at the Ministry of Health. Again, the question is to you, and if you can, I'm sure a lot has been shared by others, but we'd want to hear highlights from Guinea in terms of what your country is doing to prioritize and accelerate the adoption of the competency-based curriculum.
Bonjour à tous.
Good morning, everyone. Thank you for giving me the floor. I'd like to start by giving an overview of the situation in Guinea. In Guinea, currently, we have about 11,500 health workers who are in the public service. And their needs are ever present. In the rural areas, remote areas, hard to reach areas, there are needs over there. And so what the country has done this year is that this year we have included them more when it comes to the distribution of health workers. The Guinean government has developed several reference documents and plans to implement strategies in the health sector. For example, the National Human Resources Development Plan, which we are working on now, it is a reference that has helped us to conduct real diagnosis on the health situation. We also have the National Health Development Plan, which will enable us to have a wider view of the health system at the level of health centers, regional hospitals, and teaching hospitals. The Guinean government would like to harmonize the curricula in the private and then the public sectors and the public schools. Secondly, we plan to review the curricula so that it will be in line with what is going on the field. We want to train health workers who are on the field. And thirdly, we would like to organize a TOT, that is a training of trainers, which is modern and sufficient. Fourth, the establishment of an accreditation system for schools. So these are some points I can share with you. Thank you.
Thank you so much. Especially, I love what's coming out in terms even of that competency-based curriculum, that it has to align with what is in the field. For those who come from Kenya, we say it has to align na vitu kwa ground. It has to be what's literally, you have to adapt it to fit your means. And then accreditation system for schools, and indeed I think Dr. Onyango had talked to the East African community. Indeed, they have a joint inspection team, at least for medical doctors and dentists, that they can then be reciprocal recognition, and I'm sure this competency-based curricula will go a long way enhancing that process. Now we'll take a slightly different turn as I move to the other speakers on the panel, and starting with Dr. Tirone, who is from the Africa Centers for Disease Control and Prevention, Africa CDC, and is a public health expert specializing in health workforce development. And the question to you is, what needs to change in how countries plan and fund health professions education so that it matches real health systems needs. That has already been alluded to by the speaker from Guinea, but what do you think needs to change? And I am being very stingy on time, but I know you are up to it. I can give you 3 minutes. Thank you.
Thank you very much. Thank you very much, Madam Moderator. I think we've heard from the setting the scene on where we are in terms of the health workforce is concerned and in terms of harmonization. But I want to start from asking a question. Are we training our health workforce for today or for the realities they'll be graduating in? Just an example, I think there are I'll cite 3 published literature. The first one comparing physicians' diagnoses with artificial intelligence LLMs. I think our first speaker showed us the diagnosis of our physicians, where they are. The AI was able to diagnose 52.1%. And the research found that was published in Nature, it found no comparable difference with physicians, but found significant difference with expert physicians. Similar models that's run in 2026 showed even better diagnosis models. We're also seeing literature being published of autonomous robots being able to perform surgery just by having support. So my question is, I think we all have our curricula, but if we see most of the countries, they're training the same way we were trained, in the same approaches that we were trained. But a doctor that comes into the medical school today will graduate 7 years from now. A nurse that starts today would graduate 4 years from now. And the world that they will emerge into is very different from the world that we emerged into. So one point I would like to raise is, can we be predictive in terms of how we train to the futures that our health professionals will join? The second is, we recently conducted a baseline assessment where we had different sectors, ministries of health, ministries of labor, ministries of finance, and ministries of education. And we saw some misalignment, or there needs to be that coordination at national level so that we're training what we need on the ground. But what we need on the ground is then has posts that they can be absorbed. I think our regional director yesterday showed us that we have 1 million unemployed healthcare workers, where we still have needs. But then we are also aligned towards the other sectors in terms of civil service posts, in terms of even the curriculums. Are we educating our healthcare workers on being able to create jobs themselves, diplomacy, those softer skills that will benefit them as they go on and graduate? The final point I want to raise is on data. I think we're working with WHO on the different mechanisms to collect data from countries, but still having high quality data for decision making is still a strong challenge that is confronting all of our stakeholders and our countries. So how can we come together as a group and as a collective to help countries to have better data and better decision making? And which is why at our Africa CDC we have an initiative that was AU heads of state and government approved, which is our health workforce task team, which is our coordinating platform for HRH issues. We're happy that we're working closely with our WHO Afro colleagues that are co-chairing different sessions, which intends to bring all actors together to think through what are the challenges that our healthcare workforce are facing today, what would they be facing in the future, how can we all work together, aligned within a single plan that's led by our government towards making the impact that we need to make. So just in interest of time, I'll hand over back to you, Madam Moderator. Thank you.
Thank you. A round of applause, please. Thank you, Dr. Terune, bringing in very pertinent issues about the role of AI today. Is it going to replace the health workforce? You've already talked about the unemployed, and everyone kept replaced as it should be. We look at it as artificial intelligence. At the World Medical Association, we look at it as
artificial, not just but augmented intelligence. That what it should be doing is augmenting the intelligence of the professionals on the ground, ensuring therefore that we have better diagnosis and therefore better treatment outcomes. We'll move on quickly to Dr. Kenneth Onu. He's a Principal Program Officer and Head of Promoting Standards in African Health Systems at AHWIF, and the question is also the same question to you. What needs to change in how our country is planning and funding health professions education so that it matches real health systems needs?
Thank you very much, Madam Moderator, and good morning, everyone. I bring you greetings from the African Union Development Agency, AUD and NEPAD. We operate under the umbrella of the African Union, and our mandate is to accelerate interventions towards actualization of Agenda 2063, which is the Africa we all want. What needs to change? I will be very direct in terms of my response. What needs to change is the fact that we have to be very, very deliberate and intentional about addressing fragmentation and accelerating efforts around harmonization. In the African Union Development Agency, we recognize health as a critical component of economic development. And that is why we have a directorate which is known as the Human Capital and Institutional Development, which is charged with the responsibility of coordinating and executing priority programs and projects that are beneficial to AU member states and regional economic communities, as well as promoting efforts towards integration and harmonization. So what we've done is that we have top-notch programs that we are currently implementing within AUD and NEPAD that addresses health workforce development. And we are doing this in collaboration with the AU member states in terms of galvanizing support. We have a number of frameworks that have not been fully complied with, which we promoted through a number of interventions. For example, we had the Abuja Declaration of 2001, where countries committed to dedicating 15% of their national budget to health. This is 25 years down the line. In fact, we are celebrating the silver jubilee of that declaration, but how many countries are keeping faith with that commitment? The African peer review mechanism did publish statistics to show that just about 8 countries are keeping faith with that commitment. So that needs to change. So for us in AUD and NEPAD, we want to serve as that technical interface in terms of supporting countries to be able to address these critical issues. We cannot develop Africa if we do not invest in human capital. And part of human capital is health. Health is a critical component, is a fundamental pillar to drive economic development. And we must keep faith with that. So in what needs to change is the fact that I want to share a story about what we did regarding regulatory harmonization. We were very instrumental in the creation of specialized technical agencies, the African CDC, and recently the African Medicines Agency. We can adopt similar model for the health workforce development. Regional approach, very, very critical. We must, and that's why we have this collaboration with the East, Central, and Southern African States Health Community. As we speak, there is an ongoing engagement which is focused on nursing and midwifery program happening in Kigali same time, which is focusing on strengthening nursing and midwifery under the South-South Cooperation. We are doing that in collaboration with XRHC. So that regional approach, we need to intend